My name's David. I'm a recently pensioned injured worker in British Columbia, Canada, which means that I'm entitled to, at this point anyway, a monthly wage paid by the government due to my inability to work due to my WorkSafe injuries. On top of that, I'm also entitled to health care benefits through WorkSafe BC, counseling, specialized doctors, that kind of thing, massage therapy, chiropractor, quite an extensive list. But through WorkSafe BC, not through MSP or the public health system. Everything has to go through the Workers' Compensation Board before I can access those kind of healthcare systems in the public system. Now, that's not to say I can't attempt to privately access said medical services, but I would have to pay for them. And the services are actually limited under the MSP system, which is the public system. There's far more benefits and services available under the Workers' Compensation system. Currently, for reasons I'm not going to get into right now, the security guards, corporate security at WorkSafe BC, have imposed what they call restrictions, but would be classified as a restraining order or type of peace bond by the courts. They have no authority to interfere with my access to WorkSafe BC or my caseworkers to try to access healthcare. The way I look at it is there's a door on the hospital. There's one for private every day, and then there's another door on the hospital which is for injured workers, and that's a WorkSafe door, and you have to have WorkSafe open that door before you can go through and get medical services. Essentially right now, WorkSafe is blocking my ability to access any healthcare services provided through WorkSafe BC. Now, when the pandemic came, new legislation in the criminal code, new laws were enacted. I believe it's all the way across Canada, but I know for sure it's here in British Columbia where I am, that it is an offense to harass medical staff, that kind of thing. It's section 423.1, and the clause I'm looking at is specifically bracket to bracket. So 423.1 of the Criminal Code of Canada, bracket to bracket, where it makes it an offense to knowingly and without lawful authority prevent somebody or interfere with their ability to access healthcare. Now, I have talked to the RCMP, 2 officers so far, who are refusing to investigate because they say WorkSafe BC is not a healthcare provider. I guess that comes down to semantics, and I guess will be a question of law. Because I believe that the administrative staff in and around a healthcare provider, being a doctor or a nurse, are healthcare providers as well, because you cannot provide healthcare without the administration. And as this caseworker is my door, if you will, for referrals or access to further healthcare benefits, I have a right to access that door. And no security guard in Canada has the right to impose restrictions upon a person's liberty. If WorkSafe BC, by the way, I should mention, they're asserting that their staff's safety, both physically and psychologically, is in danger from interacting with me. They say it's because I argue with the staff. But this is the same staff that denied me any medical benefits, healthcare benefits, any help, and wage loss for over 12 years when I was making applications in regard to exposures to asbestos, and the fact that my employers were dismissing me when I brought up their violations. So that's what brought us here today. We took that nice walk through the city of Terrace, and we now find ourselves coming to the RCMP station. Now, what's going to be really interesting is the fact I'm wearing a body camera. The RCMP have been mandated to have all their officers wearing body cameras. Now they say they're going to take until 2024 to do it. I believe the mandate, the order came out in 2020. I could be mistaken about that. I read, or have to read, too much. But yeah, so I'm wearing a body camera. I do believe they're going to insist that the body camera be turned off, which of course it will not be. And here we go. We'll see how this goes. Good morning.
Morning.
Hello. I spoke to Corporal yesterday afternoon. I didn't get her name. She spoke it very quickly. I should have a file number though. In regards to something going on with WorkSafe BC, told her that I needed to speak to her staff sergeant, and she said it would be best if I came down this morning to talk to them.
Sure, what was your name?
David Hamilton.
Okay.
Are you aware of my dealings with the officer yesterday at all?
A little bit, yeah. Are we being recorded right now?
Yes, you are. Yeah. I know that's new for everybody. It's new for me as well. Yeah.
Everything recorded is...
No, I know you guys got them as well. I know. I spoke to Staff Sergeant in Kitimat a couple weeks ago.
Oh, Staff Morgan?
Yeah, exactly. Yeah, Graham Horton, yeah. Really nice fellow.
I know Graham quite well.
He came and spent about an hour or so with me at my home, anticipating this kind of uncomfortable situation that we find ourselves in.
Sure. So what can I help you with?
I'd like to press charges against Paul Cuthill.
Paul
He's corporate security at WorkSafe BC.
Okay.
He's interfering with my ability to gain health care.
How's that?
Well, he's blocking my ability to talk to my caseworker so that I can access health care. Now, if I may, before you go on,
Sure.
I'm not sure if you're the sergeant that the corporal that I talked to yesterday got her recommendation from. She came to me and said, I've asked my superior.
Should probably talk to her corporal.
Okay, and so what she said is that they don't give health care at WorkSafe BC.
They don't.
Okay, I disagree with you. Can you get an officer to come with me to WorkSafe BC where we can actually talk to them and confirm that WorkSafe BC actually gives wage loss and health care benefits?
Okay, but have you put in a claim with...
No, I have an active claim that's accepted. It's right here. I've been pensioned April 1st, and as of April 1st, they cut off my ability to get any health care services.
Okay, why'd they do that?
Well, I'm not privy to that. I would say that it's probably retaliatory because I defeated criminal charges in the courts in Courtenay.
Okay.
which they do. I have evidence of retaliation. I have a letter where they slander me and libel and say that I was found guilty of those charges,
Right.
as well as they cut off my VR benefits. My counselor, that's actually a WorkSafe employee, will actually testify to my persecution. I have that right in here in the letter, that I'm being persecuted by the government. So they're continuing that persecution by blocking my access to this. Now, your position is WorkSafe doesn't provide health care?
They don't.
Then can you get an officer to come with me so that I can confirm that? You could confirm that by looking online that healthcare benefits are actually part of a WorkSafe claim. But you're choosing to not investigate and to make an ignorant position. That's my opinion.
No, because hospitals provide health care.
But-
WorkSafe
but
BC does not provide health
If
care.
I may, they're the door. When I have a claim, I can't go to the hospital and walk in and say I have a WorkSafe claim and I'd like to see a doctor.
No, but if you had a physical condition, ailment, whatever, and you needed treatment, the hospital would treat you.
No, they will not, because they will not receive payment because it's under a WorkSafe claim. So WorkSafe has to, before I can get any treatment, they have to approve it. Just like you, a budget. You can't go out and buy stuff for the
Has WorkSafe
RCMP.
said anything to you about your claim being denied?
No,
or
no, sir.
anything
And
like
you to ask these questions, you should be coming with me to WorkSafe, or the corporal should, and investigating.
that? I'm not going to WorkSafe BC.
Well, I am,
Right.
and that's what I've said is if they continue to deny me, and what I've said is there's a crime under section 423.1, bracket 2, bracket, it's an offense to actually prevent somebody from being able to access their health care.
No.
It's,
Forgive me, but my understanding is from the little I know about the file is that WorkSafe BC is in a position where they're not wanting to speak with you any further. Is that correct?
well, they don't have that, you see, here's the only thing is if they don't want to speak with me, that's fine. They made a, that what they've said is they believe they're in fear of their own safety, both physical and psychologically.
Sure.
So you must have talked to them for you to have that
I have
knowledge.
a little bit of knowledge from talking to the officer from yesterday.
Okay, so why would then the officer must have talked to WorkSafe and they said that they choosing not to speak to me?
I just want to talk to the officer.
Government officials are not allowed to choose not to speak to people
Well,
and to cut off their access to
It's
benefits.
no different than going to any establishment. If they have a fear for their safety.
No,
of
but they
their
don't.
staff-
This is what I'm telling you. I've defeated that in court. I've defeated that in court. This is an unreasonable.
Maybe you
They
have.
don't have a fear. If they are saying
if
that.
they
That's why
do-
I'm wearing this body cam, because
If they do,
they don't.
if they do,
They don't. You don't get to just say, and if they are making a false claim of fear, that is public nuisance. That is also, and that's also a
I would
crime.
encourage you, sir, if you have an issue with WCB,
No, it's not. Currently, I have an issue with you and this department, that you are taking a position that WorkSafe BC, and you can see I'm getting elevated.
Sure.
I have PTSD-like conditions. They're recognized. That's what my claim is. So for you to say that you're going to give deference to a public employee, no, he's not. He's actually private. The security do not work directly for WorkSafe BC. So this is just an individual blocking my access, and you're giving them deference.
well, if he's being advised by his superiors.
No,
that
no.
they
Just
don't
because
want
you're
you on the
told by your
property,
boss to commit a crime doesn't mean you can commit a crime.
It's not about committing a crime. If he's been told by his superiors that you're not to be on the property,
No, but I have been told I'm allowed to go to the property,
Right.
but I'm just not allowed to talk to my caseworker.
okay.
No, that's not
And
reasonable.
again, if the caseworker chooses not to
No,
speak.
here, if you can have, no, she doesn't have that right. And if you can, listen
She-
to my logic here. Listen
if
to my
she
logic.
doesn't
No,
wanna speak
give
with
me
you-
a second.
If she
No,
doesn't want to speak with you because she has whatever.
she doesn't. And here's what I'm going to say. She has that
You
fear.
can't claim that for her.
No, it's been tested in court and proven that it was wrong. Now, that's the fact, is it went to court. You guys don't get to do this. You can't assert. I've already talked to my MLA. She said if they are,
And that might
let
be
me
the
finish my
proper
fucking,
way for you. Hey,
let me talk.
You need to get your voice down.
No,
not be
I have a
swearing.
medical condition. You're right. I'm sorry for
Right?
swearing.
If you wanna-
No, I
well,
understand.
Let me get ahead of this. If you are willing to have a conversation with me that doesn't involve swearing and yelling, we can have that conversation.
But you have to have that conversation. You can't just
Barring
claim
that,
facts.
Barring that, the door's there.
That's fine. You want to have a conversation with me that's reasonable and based in the
Absolutely.
law?
An adult conversation I
Then
can have with
what we can do right now is, because you're making this assertion, is that they fear for their safety, right? That they fear for their safety. That's what you're saying.
you. Do they?
No, there's no reason to say.
And
Here's
how
it.
do you
Let me
know they
finish.
don't?
Here's the thing. The only reason they fear for their safety is because corporate security have told them that I'm dangerous and they need to lock the doors and fear me.
Okay.
No, that's not. That is slander right there. That's slander.
There's nothing about that that's going to be slanderous.
What?
If they have,
Wait, no, WorkSafe has told them that I was found guilty of crimes where I was found innocent. That's slander.
well, that's something you're going to have to go back to the courts with.
No, I don't have to. That's actually a criminal charge. Are you saying that libel and slander are not in our criminal code?
They're in criminal code.
Okay, so then why do I have to go back to WorkSafe and go to get a lawyer?
If you've already been involved with WorkSafe, you have a.
I'm just reported
issue-
to you
issue
something that
there.
you confirmed to me is in the criminal code. I have evidence that it happened, and you're not willing to even look into it.
What evidence do you have, sir?
I have a letter from them that says I was convicted of crimes
Okay,
that I was not.
okay. And do you have anything from the courts you can provide that says you weren't?
Yeah, we could actually call John Boccaccella, the Chief of Crown Counsel for Vancouver Island, and he'll confirm that all charges were not just stayed but withdrawn. You could look in your own computer and do that. And you know that. No, not well. You're choosing to not investigate, and that is a crime on your behalf. And it's going to be hard to charge you, but I'm going to personally go and sue you for blocking my access to WorkSafe BC as well. You're doing that by not doing your job. No, I'm going to assert that, and I'm going to go to court, and you will be held liable in small claims court for assisting Paul in blocking my access. We're just working down the line.
If security doesn't want to let you in because of whatever information that they've been apprised of, that is a decision that they're making.
They don't get to. They don't. They are not enforcement officers.
WCB does not have to deal with anybody that they don't.
No, that's not true. They do.
They have a fear for their safety.
They don't have a fear. That's false. It's a false fear, and I'm asking you to investigate that false fear.
Well, I'm not going to be doing that.
And why would you not do that? See, here's the thing. You could settle this easily. Your position is that they don't help. Or your position was, is it still that they do not provide health care?
They don't provide health care.
Okay, then put an officer in a car. I will walk down there. We will both go in and we can talk to WorkSafe BC. We can even look at the literature and see if I am entitled to WorkSafe benefits only through WorkSafe.
My information is that you were denied a claim.
Well, your information is, here you go.
If you were denied a claim.
There you go. It's accepted. I was pensioned. I was not denied. Who told you that?
If you were denied a claim.
Who told you that?
Then there are.
Who told you that?
Processes that you need
to answer the question, who told you my claim was denied?
Let me look through this, please, Mr. Hill.
No, give me this. This is my personal information. Answer my question. Who told you my claim was denied?
You need to calm down.
Okay, but who told you my claim was denied?
The officer that I spoke with.
Well, did she talk to WorkSafe?
I believe she did.
Okay, well then they lied to her.
Why would they lie to her, sir?
I don't know why they would lie to her. Let's go investigate that.
There's no reason for them to lie.
I can tell you. Here's why they're lying to her. Yesterday morning, I had an online virtual court case that's going on in Ontario, where I'm a party to a class action lawsuit against WorkSafe BC for this kind of treatment.
Sure.
So this is retaliatory.
Okay, so you have.
So that's why they would lie to you.
You have something in the courts currently.
Absolutely.
Okay, I would encourage you to pursue that.
No, it's not about this. It's not about this. It's a different thing. It's about a different issue. You don't get to say you have something in the courts. I'm not going to look into this. This is a crime that's happening now. Now you're refusing to investigate. You're refusing to do anything. You're on camera. When I go to Facebook, that will be on Facebook Live as well. So I anticipate they will call you. I anticipate a wrongful arrest. Like I said to the officer yesterday, sir, when you come, I am keeping the peace. I'm trying to conduct business that I have at WorkSafe BC. I have an active claim. Let me finish. They're denying me health care benefits. So when they refuse me, I'm going to refuse to leave. Now, I have that right. I'm asserting that I have a right to benefits. I ask you to keep the peace. When I talked to the officer yesterday, she said if she has to come to WorkSafe BC, she's putting her gloves on, she's cuffing me and arresting me and putting me in the car. Would an undertaking not be more appropriate in this situation?
You know what? If you're more than willing to just walk away from that scene, there's no need for an arrest.
No, because I want to go see a judge because I'm going to test all of this. I'm going to test everything. So that's why I will allow myself to be arrested wrongfully. But I ask for you to honor your policies, the law, and simply issue me an undertaking. In Courtney, they beat me and held me for 30 hours. No, let me finish. That's wrong. You come, you keep your gloves off, you offer me an undertaking, I will gladly come to court and I will meet you there and we can talk about these issues in front of a judge.
If it's a simple thing where you're willing to leave, there's no need to issue an undertaking.
I'm not willing to leave. That's what I'm saying. I'm going to go there, and until I get access to my caseworker, not corporate security, to my caseworker.
If the caseworker does not want to speak with you, they don't have to.
Then here's the thing. I went there last night. I said, if that caseworker is uncomfortable, then we can transfer to another caseworker. Why don't we do that? Would that not be reasonable? If you and me.
You know what? That is up for WCB to decide.
No, it's not. It's actually not up for WC to decide. I have a right to benefits. I have a right to health care in Canada, and that's actually under the health. Oh, I didn't bring my phone. If you look under the Health Care Act, I have a right to be treated with respect, dignity, and equitably under the law. Equitably.
I don't disagree with that part.
Okay, but you are. See, Paul Cuthill, I've told you, is blocking my access to healthcare. It's a violation under the criminal code, and you're saying that he can do that because his boss told him to. Here's the thing. I am on a WorkSafe claim right now because my boss told me to do a job in a church. It exposed children to asbestos. Is it your position that because my boss told me to, I should have continued that action?
I'm not going to get into that with you, sir.
Because that's what you're saying right now. You're saying that WorkSafe BC, because his boss told him to do something that's wrongful, you're going to allow it.
It's wrongful in your opinion.
No, it's wrongful by law. I can point to, like I've showed you guys. You guys are saying that WorkSafe doesn't provide health care, and this is going to go online, YouTube. You are going to be online saying that Workers' Compensation Board does not provide health care benefits in British Columbia, and that's the position of the RCMP.
Clearly, you have your mind made up about this.
Have a good day, sir. The RCMP do not believe WorkSafe provides health care. That's the RCMP position. I'm not going to have a good day, sir. Well, folks, there you can see. Exactly what we figured would happen, happened. I'm going to stop the video now, and we'll pick it up when I get to WorkSafe BC.